Because of the burn, we can't perform any of our normal tests to see what's wrong. So we're going to try a galvanometer. It picks up a pulse in the wrists and the ankles. Hopefully it'll tell us why his heart rhythm is abnormal.
What have I done to him, Mike?
It was an accident. So, he's got all these burns, and now there's something wrong with his heart?
We're trying to figure out if the two are somehow connected. Had he been sick lately?
No, nothing.
Anything unusual with his behavior? Had he been tired a lot?
Nothing.
He was great. He was happy. He was just having a great time, and then...
If he was experimenting with amphetamines or cocaine...
No. We gave him some pot about a year ago to try.
It was just once. We thought if we took the mystery out of drugs and alcohol, the less he'd experiment.
We'll know more after the tests.
It looks like they're gonna electrocute him.
Plug it in. You plug it in.
Fine. Give me the cord.
Works. Prominent U waves.
No, inverted T wave. No ischemia.
Q wave normal. That's not good.
Chase, turn it off. Turn it off. What's happening?
What is that?
Satan, get in here.
Something that disrupts brain function. The plaques are perfect. Interrupt neuronal communication.
MS?
No. MS is complicated. I think this is more basic. It's just tachycardia and seizures. How much longer the burn unit guy's gonna keep him in that thing?
Lecture's over. Let's go. House wants to... Adam's waking up.
Get the anesthesiologist in here now.
He's in pain.
That's no pain.
Need some help in here.
Adam had an orgasm.
What? You mean while he was...
What's wrong?
I'm having a migraine. Differential diagnosis for getting off.
Is he gonna be okay?
No, something's seriously wrong with him.
Differential diagnosis for ejaculation. Don't make me sad again.
We're not stalling. We just don't know.
Then guess.
Could pain medication cause an orgasm?
I wish.
Maybe pain caused the orgasm. You get a tattoo, the brain releases endorphins, which create pleasure.
Most people don't orgasm from a needle prick.
Well, Chase has a point. The brain is like a huge train station. If the switches get... You're the neurologist. Talk for me.
If sensory information got misinterpreted by the medial forebrain bundle, it's possible for bad to feel good and good to feel bad. He doesn't have MS or an infection.
His proteins aren't elevated.
Wrong protein. IgM, not IgG. Elevation was probably caused by the bleed.
What if there was tingling in his extremities prior to the crash?
How can you still be on MS?
I gotta be on something. Something's interrupting his neurons' chit-chat, like lesions.
We can't scan for them. The only test we can do, we just did, and it was negative. He has no tingling, no numbness. And you read his history. Parents didn't say anything about it.
What about Adam?
We can't look into his brain, but you want us to read his mind.
Good point. Yeah, you can finish the sponge bath in a minute.
They're just redoing his dressings. He's out. He's fine.
I didn't pay you to put him out. I paid you to wake him up. Why are these lights so damn bright? Thank you. Come on, I need to talk to him.
House, you can't wake up a burn victim to play 20 questions. It's torture.
He won't remember.
He's going to be in extraordinary
God,
shape.
you're good. You're putting me to sleep. I know he's going to be in pain. I know you disapprove. I'm his attending. Wake him up.
Oh my God.
I'm Dr. House.
It hurts.
It's gonna get a lot worse, so answer fast. Before the accident, did you experience any numbness or tingling in your fingers? You got burnt. It's healing. I need an answer.
It really hurts.
Any tingling in your arms or legs?
Do something, I can't.
Adam, you gotta listen to me. Did you feel anything?
I pissed in my pants and then I don't remember.
You look better.
I took something.
Mind if I ask what?
Little of this, little of that. I know what's wrong with our patient. He's depressed.
He told you that when you woke him
Nope.
up?
Told me he pissed his pants and blacked out.
It's not diagnostic of depression. Lack of appetite, isolating yourself.
Uncontrollable urination and blacking out are good predictors of what?
Seizure.
Which means the seizure he had when you tested his heart was at least his second seizure.
So what? Depression and seizures aren't correlated.
No. But you know what is? Depression and anti-depression medicine.
Toxicroom is clean.
But you know how much crap he's got in his system from dealing with those burns? The guy could have the Spanish Armada floating through his bloodstream. We wouldn't know about it until they started firing cannons.
Antidepressants have been known to cause seizures in kids, but not orgasms. This is a brain in trouble.
This is a brain with too much serotonin.
Serotonin affects mood, appetite. It doesn't cause brain to shut down.
Antidepressants fake brains into thinking they have more serotonin than they actually do. Every 10 million or so cases sets off a chain reaction. Produces too much, enough to fry itself.
If Adam has serotonin storm, it's deadly.
But treatable. Cyproheptadine.
Unless he doesn't have serotonin storm. He could just as easily have too much dopamine as serotonin, but if it's dopamine, the cyproheptadine will kill him.
Where you go? I'm gonna talk to the kid again. Seems nice.
You can't.
Why? Did he say he doesn't like me?
Anesthesiologist told the parents what you did.
Everyone's a tattletale.
What are you doing?
You can't come in here. You're not sterile.
Don't touch our son, we told you.
Seriously, millions of bacteria, microbes on you. He'll die of sepsis.
If you go in there.
I think he's gonna wake him up again. I know he is. House, you can't do this.
Oh, if I had a nickel for every time I've heard that. Relax. They're gonna sue us? If I'm right, I save his life. If I'm wrong, he's dead no matter what I do. Either way, how much have I really hurt them?
Leave him alone!
You're not sterile. So you want to kill the kid?
Give me this syringe.
No pain, no gain.
Hey, you gotta stop this.
You're right. He's not depressed.
Yeah, sure. I'm not letting you go till you give me that syringe.
What's that on his wrist?
A burn.
Why on his wrist?
Why not on his wrist?
His back, his torso, everything's a mess. Forearms are clean, except right there.
So what?
It's a perfect circle.
So a drop of burning gasoline fell on his wrist, a screw from the ATV.
Maybe.
Why are you torturing him?
Does your son smoke?
I'd kill him.
So, he can talk to you about sex, crack, anything except cigarettes. He has a cigarette burn on his wrist. Also, a fading nicotine stain between two fingers. Bad news, your son has a filthy, unhealthy habit. Good news, he's trying to quit. Bad news, the quitting's killing him. Good news, I can cure him. Bad news, nope, that's the end of it.
Quitting smoking can kill.
No smoke meds or antidepressants. Crappy ones you get over the internet. Loaded with whatever antidepressants they can get cheap. And since mommy and daddy obviously didn't take him to a pediatrician. Sorry, I was wrong about him being depressed. Treat him.
How could she be allergic to everything?
She can be. Has to be an infection.
You see a positive allergy test and decide it's infection.
Bacteria got into the scratches in her back.
Infections radiate.
The shape of this is...
Eat this.
I don't feel like eating.
Make you better.
A sandwich.
Magic sandwich.
There's no such
Just
thing.
take a damn bite, okay, kid? Amazing how she didn't go into anaphylactic shock.
It's diagnostically ridiculous.
Right. She's allergic to everything except peanuts.
She is allergic. Antibiotics could cause a massive systemic reaction.
If she's allergic. If she's not.
Chase, you're right. The shape indicates allergy, the tests indicate allergy. Just because she's not allergic to peanuts doesn't mean she's not allergic to lidocaine or...
Chase, hang the bag. You can grow a backbone tomorrow.
He doesn't freeze my counts, I'm guilty. He does freeze my counts, I'm guilty.
Is Alice having some procedure done?
She's fine, she's resting.
Where?
In a room where you're not supposed to...
I was just at the window. There's no one in there. Her backpack wasn't there either. You don't think her father could have...
Call security. Get it, Gurney.
She's stiff. She can't move.
I don't know what happened. She seemed fine.
Let's help her, please.
Which one of you two gave her an aspirin?
What?
Her symptoms fit Reye's syndrome, which doesn't make any sense unless she took aspirin.
Rob?
No way. She's a kid. I've read the 800 warning labels.
I'm not even angry. I just want her to be okay.
She's lying. She's angry because you kidnapped her kid. She'll be angrier if the kid dies.
I didn't.
One aspirin combined with a pre-existing infection is all it takes to set off an attack.
I'm not lying.
Well, sure. You certainly earned her trust. Where was Alice the night before she came in?
With me? Well, at my house. I went out. She stayed with the babysitter.
Where were you?
None of your business.
You hired someone that might have poisoned our daughter.
She's 15. She's very responsible.
Is she a 15-year-old pharmacist? Or just some kid from down the street who needed 20 bucks for lip gloss and a couple of tiger beats? Put your kid on charcoal hemoperfusion.
Should we see what the babysitter has to say?
I know what
first?
she's gonna say. She's gonna lie to save her business.
We are going to use this machine to clean your blood. It goes out of you and through a filter, like the filter in a fish tank. It's kind of cool, actually.
I'm scared.
It won't hurt. It takes a while, so it'll be boring, but it won't hurt. It's gonna make you better.
They hate each other, don't they? Never gonna be together again.
Well, you never know. How's it going?
Boring.
Told you.
So far, so good. Just like 5 minutes ago, 10 minutes before that.
What's the matter?
Something on a clock.
Let's get her out of here. I'll call the OR.
You said it wouldn't hurt.
Found it.
She's burning up.
Give me a sec.
Foreman sheet is on fire.
Almost there.
Get you some cooling blankets now.
Right away.
Every time we touch this kid, something goes wrong.
Bad mojo is not a diagnosis.
Look at her arm.
I told you it was an infection.
We fixed the infection.
Well, apparently not. I asked you for broad spectrum. You put her on the bare minimum. It's a good thing you failed to become a mom because you suck at it.
Chloramphenicol isn't working.
What dose did you give her?
Yeah, maybe Chase screwed up. We always end up there, just getting a jump on it. I doubled her up.
The infection's morphed. It's moved into her muscle sheath.
Necrotizing fasciitis?
That's impervious to drugs.
The only treatment is to cut away the infected area. So we amputate.
Arm and leg? We can't cut a 6-year-old kid in half without a confirmed diagnosis.
Moves too quickly, and we waited too long. We don't have time for culture.
We can at least observe her for a few hours, confirm the rash is spreading.
If it spreads, she dies.
You're talking about crippling her.
We're not even certain this was an infection.
Right! She's sick. She's cute. She can't have flesh-eating bacteria. It's just wrong. Let's cure her with sunshine and puppies. Cute kids die of terrible illnesses. Innocent doctors go to jail. It's because cowards like you won't stand up and do what's required. You can sit around and moan about who's the bigger weakling. I'm gonna go do my job.
What kind of quality of life will she have without...
Great thing about life, it's got qualities.
And if we can't agree?
I don't know.
He's yelled at us before.
Because he thought our theories were dumb, not because our theories were sending him to jail.
He's going through withdrawal. Could be causing mild paranoia. It'll pass. We just have to suffer through it.
We never ruled out allergy.
We gave her drugs. She had no negative reaction.
We cut open her belly, she got a rash on her belly. We did a scratch test on her back, she got a rash on her back. I know House ruled out mojo, but it can't be a coincidence
Little late to be playing differential games, isn't it?
Hey, get that thing away from me. I don't want to get burned.
Laser pointers don't burn, you genius.
Skin, no. Retina, yes.
You don't trust my aim? Maybe you should cover any sensitive... He was wrong about the puppies. House! Gotta stop the surgery. She doesn't have necrotizing fasciitis.
Oh, good.
She's got erythropoietic protoporphyria. She's allergic to light. It's genetic. Either parent could have carried it.
I know what it is. Infection fits better.
She gets worse every time she goes under surgical lights. Dad takes her outside.
Liver shot, too. She swallow a flashlight?
Stop the surgery.
Get the hell out of my way.
No, I'm... Light damages the blood cells. The damaged blood cells contain protoporphyrin. The protoporphyrin builds up in the liver. That's why the liver's shutting down.
Be allergic to light. She's never had this problem before.
The negative reaction starts at birth. It reaches critical mass around this age. Her blood cells create chemicals in reaction to light. When they reach the liver, it tries to filter out the bad cells. The chemicals damage the liver, and one byproduct is gallstones.
So she'll just keep getting worse?
EP can be managed. We'll give her beta-carotene. She's gonna need special light bulbs and filters on the windows. She's probably gonna need to be homeschooled. Her life will be complicated. But she will live.
How do you get something like this?
It's genetic.
So one of us.
Both of you must be carriers. She's gonna want to see you when she wakes up, so don't screw it up.
Ow. Can we hurry this up?
Make sure they take your time. What's your name?
Hannah Morgenthau?
You have SEPA, Hannah Morgenthal.
Oh, I don't.
We have to do x-rays to make sure you don't have internal injuries, blood tests to make sure no infections, EEG for neurological anomalies, and biopsy of spinal nerve.
Whoa. Congenital insensitivity to pain is one of the rarest conditions on the planet. There's only been about 60 documented cases.
Yeah, and I have 7 reasons to think that she's one of them.
She says she's not.
And that's reason number 1. She knew what it was without us telling her. 2, she's still wet from the snow. She's not shivering. That's odd. Unless she can't sweat or feel hot and cold.
The ambulance was warm. I want to see my mother.
3, scarring around the lips and tongue. When she was a baby, she chewed on herself without feeling it.
I fell through a window when I was a kid.
4, when you cleaned the wound, she flexed into the cleaner instead of away from it. It's hard to fake pain when you've never felt it. It takes an imaginative leap, Ms. Morgenthau. She wants to see her mom. She admits having SEPA. She knows we're not letting her go anywhere without a battery of tests.
You said you had 7 reasons.
I pulled the number out of the air. But 5 isn't enough.
5 lame reasons aren't. Taking her to see her mom as soon as...
I could hit her again. 6 isn't enough. Do the tests.
I'm sick? No, your EEG was normal. X-ray showed no breaks. Blood test showed no infections. Urine indicated no... Anna? Call code. God. Need ice packs and cooling blankets. Got saline in there?
She's not flushed. She's not sweating. You must be...
She has a temperature of 105.
And that's gonna make me feel pain? I didn't feel anything when you guys screwed this thing into my head.
It'll replace missing chemicals in your nerves. Heightened sensitivity. We're going to be drilling directly into your skull. The response should indicate sarcoma.
What does it feel like?
It hurts. Sorry. Bone pain is the worst there is. So you need to let me know as soon as you feel anything. She's ready.
So what? I just sit here while you guys drill a hole in me? You want to talk?
Just you and your mom, huh? You two must be pretty close.
We were, until I got arrested. 3rd time.
Drugs.
Fights.
You've got an advantage.
Not really. Never know when to stop.
You piss a lot of people off, or you're just trying to piss off your mom. Those are pretty much the only 2 choices you have. Anna? You want us to stop?
Stop the drill. Stop the drill.
It's okay. What'd you feel? Where did you feel it? Hannah, I need to know how it hurt. Hannah!
Get away from me! I'm not gonna hurt you.
Yes, you are. You're so jealous I can do anything.
Hannah, you're having a paranoid delusion.
I don't believe you.
You think she would?
This is real. You want me to be in pain. You even said so.
If we wanted to hurt you, we'd let you jump.
Just let me see my mother.
Fine. We'll take you to her OR observation room.
I don't believe you.
Your mother is fine. I just spoke to a surgeon.
I don't believe you.
Hannah, what do you want from us? What do you want us to do?
I can't feel my legs.
You're trying to pull the same stunt twice in 10 minutes.
I'm not pretending. They don't hurt. They're just there.
Anything? We're not looking for pain. Anything at all? Pressure?
Nothing.
You have 6 broken bones, a fever, a concussion, erratic heart rhythms, and a complete lack of sensation below the waist.
I feel fine. Has my mother had a surgery yet?
Not yet.
This is excellent.
The paranoia seems to have dissipated, but her vitals keep getting worse. She could be dead in hours.
But if you're gonna die a miserable, lingering death, pain-free is the way to do it. Are we sure the fall didn't cause the paralysis?
The paralysis caused the fall. Spine's clean. No vertebral fractures or spinal cord compression.
Even better. The nuttiness and paralysis mean there's definitely a neurological component.
Could be a nerve disease.
Which is why we need to look at the nerve that you didn't biopsy.
I shouldn't have gone out on the ice.
I shouldn't have fallen down. And I shouldn't have made you rush me to an ER for the 10th time this year. Mom?
Well, you okay? Then I had to take her back to surgery. Hannah, your BP is way up. We need to get you some rest.
My hand's wet.
You're crying.
I can't cry. My head is killing me.
What if we add guilt?
Guilt as a symptom?
Alzheimer's can cause euphoria, pain causes depression, and B12 deficiency causes guilt, along with all that other stuff.
If she felt guilty, she wouldn't be making her mother's life miserable. She wouldn't be getting in fights, getting arrested.
Maybe she's fighting because she feels guilty. She's showing her mom she can take stupid risks and still be safe. Means mom can let go.
Which is rational. If guilt is a symptom, it's caused by the illness, not by a thought process. And it would have to be new.
A couple years ago, she was a model student.
This is pointless. If the headache was caused by guilt, she has a B12 deficiency. If it's just because she was sad, it's meaningless. How the hell did we test for that?
We don't. Give her a shot of B12, and she gets better. I was right.
We already did. The ER gave her B12 when she was admitted. Part of a multivitamin supplement. Apparently, she's just sad.
Is it possible for you to just watch me eat? Or do you get some primeval thrill out of beating the other hunters to the food? See you later.
You still haven't figured out that I don't need sedation?
So you don't move during the procedure.
Is that nitrous? What, are you trying to kill her? Gave her nitrous during the EEG. That's what made this thing rear its ugly.
What thing?
B12 deficiency.
Are you having deja vu? We've had this conversation. She was given B12. She didn't get better.
Because someone else ate it. Get an abdominal MRI.
What? What are you doing? Don't touch me!
See? There she goes.
Don't touch me!
With paranoid delusion. Marichi's going downhill. Forget the MRI. We need an OR.
Leave me alone! Occupied!
Her hernia can wait.
Help! They're trying to kill me!
Okay, you can either believe that we really are trying to kill her, or you can assume that she's suffering from a medical condition. Seeing as this is a hospital and we're all dressed like doctors and there are easier ways to kill somebody.
Bev, help them.
I'm gonna need iodine, scalpel numbers 10 and 15, forceps, and a largish salad bowl. Okay, hold her down. Come on, weenie, she's in a cast. Swap. 15.
You're not going to anesthetize her?
Relax, it's just a magic trick. She's faking it. We're not falling for it this time. Okay, keep that retracted. Forceps.
Lake fishing can be fun. It can bring the generations together. If you don't cook that trout or perch well, you'll be giving room and board to this fella.
By free board, I mean all B12 you could take in.
I could have a tapeworm in me.
Not likely. You'd be in a lot of pain.
It's gotta be 25 feet long.
Damn it. World record's over 60.
Damn it. Shelby, are you all right?
She can't breathe! Call a doctor!
No tumors or punctures in the lungs, no bruising, no sign of trauma, no STDs.
And supplemental oxygen's only gotten her saturation level to 60. Lungs keep collapsing despite a chest tube.
ER ruled out the obvious, white count and temper normal, so no pneumonia.
Coffee's burnt, 13's wearing cherry-flavored lip gloss, Foreman's staring at you. Any of that helpful?
House.
STD?
You said the tests were negative. You think we should know?
She's a dancer. What about dehydration?
What about a pulmonary contusion?
CT showed no inflammation on the lungs.
What about dehydration?
BUN and creatinine are elevated but within range.
Hey, I'm just the irrational part of your brain, but elevated means high, right? Dehydration could hide an infection.
Dehydration could hide an infection. Go treat her for the obvious. IV fluids and antibiotics for the pneumonia.
When we inject the water, it's gonna feel like you're drowning, but it'll be over in a few seconds.
Then it'll be better?
A little.
Hold her shoulders down a little. Ready? Here comes the liquid.
Ow! I slipped. Oh, no. What? Her skin came off.
Skin is sloughing off faster than we can replace it with the artificial skin.
Could be autoimmune.
And it was negative.
Focus on the lungs.
You want us to ignore the fact that she's lost 80% of her skin?
You know, it's not lung cancer. It could be a liver tumor. Eats through to the lungs. Get an ultrasound of her liver. If you find masses, get a biopsy.
We can't just ignore the skin. It's obviously the most significant and dangerous symptom right now.
I don't think it is a symptom. I think we caused it.
By doing what?
I prescribed antibiotics.
Toxic epidermal necrolysis. That's a 1 in a million reaction.
Yeah, well, maybe this is the one. Get swabs of her old skin to confirm.
I'll actually be dead,
Just your heart. Just for a little while.
hopefully.
Left atrium is fine.
Left coronary artery also fine. We're almost at 3 minutes.
Keep going.
Cody tendinite clear.
Right atrium is fine.
I've got to start her back up.
We have some time.
We're over.
Right coronary artery is fine.
The 3-minute threshold is a guideline.
She might have less. We have to stop.
What's that by the aorta?
I don't see anything.
I'm restarting our heart.
That's a shadow, 2 centimeters.
Was a shadow on her heart.
She'd already been technically dead for 3 minutes. I thought keeping her alive took precedence over prolonging the photo op.
Any brain damage?
No, all tests indicate that.
Obviously, you have more time.
Best of luck.
I assume we can't kill her again. Take more pictures.
You'll want to check with Wilson?
Good one.
It's something. A lesion.
Tumor, scar tissue.
Could be an abscess infection. Explains why it's invisible in the blood. It's doing its damage behind closed doors, sealed off.
See, the problem with speculation is you make a spec out of you and some guy named Lation, which really doesn't affect me at all.
We have to guess. It's all we've got. We can't do a biopsy. Last time we went into her heart, she had a major cardiac event.
Which just leaves...
What are you looking for?
I don't know yet.
Picture doesn't change. She lies there in pain. He sits there worried.
Nothing changes. I just had an epiphany. All by myself. Popped into my head out of nothing.
Care to share?
He's too devoted.
Too devoted. You think he feels guilty?
Right, I'm being cynical. People can care because they care, not because they cheated. Theoretically true. But gonorrhea fits better.
No, no STDs. We tested her.
Tested her blood.
That is the test.
That's not where her problem is. Gonorrhea disseminated to her heart. Got walled off in an abscess. It'd be invisible.
And would look like a shadow.
No need to test her again, but we can check Prince Charming.
Once you confirm, cut the abscess out of her heart.
Am I okay?
We were able to successfully remove the abscess from your heart, but the dopamine caused the blood vessels in your hands and feet to clamp shut. We need to amputate, or the gangrene will spread. You'll die.
My feet.
And your hands. I'm sorry.
No, I'm a dancer.
The tissue can't be saved.
No.
We know what House would do.
House would have never woken her up to ask for consent. If you can't live with the answer, don't ask the question.
You're saying we should accept her decision.
Bold idea, I know.
Maybe we can get the boyfriend to convince her to do it.
Yeah, boyfriends get everything they want.
Forget it. The boyfriend doesn't want to talk to her at all.
Where are you going?
Home. The case is over.
No, it's not. Not until we come up with something that might work. It's a shame that she might die because House has some personal crap to work through.
Technically, if she dies, it's because House has some personal crap to work through, and we weren't smart enough to get the answer without him. This isn't gonna work.
It might work. That's all we're going for. Vasodilators can...
Big jump from reopening to reanimating. I'm out of the ulnar. Not seeing any clearing. This won't work.
This probably won't work.
Radial artery's really tight.
Don't go too fast. If it clots, she loses the hand.
If it clots, she's dead. I can't believe it.
What?
It might be working.
Where's Jeremy?
He left. You okay?